All right, buckle up, everyone, because today we are diving deep into the world of mood stabilizers.
Oh, yeah.
You guys sent in this fascinating YouTube video called Mood Stabilizers Pharmacology from a channel called, and let me tell you, it's like stepping into the shoes of a doctor,
Yeah.
trying to solve these medical mysteries
Yeah.
and figure out how these medications can actually help manage bipolar disorder.
Yeah, it's a really interesting area. And I think before we even get into like the specifics of each drug, it's helpful to remember what we are even talking about, right?
Yeah.
So we are talking about mood stabilizers, and really these medications are all aiming to prevent those extreme highs and lows
Right.
that are associated with bipolar disorder, which, as the video points out, we kind of refer to those as the two poles,
Yeah.
mania and depression.
Yeah, and that's a crucial distinction, right? Because it really impacts which medication might be the most effective.
Right.
It's not a one-size-fits-all approach.
Exactly. Yeah. Take lithium, for example, right? It's been the go-to treatment for mania
Yeah.
for decades and decades.
Mhm.
But what's so fascinating is that we are really only recently starting to understand how it works
Right.
at like a molecular level.
Yeah, the video mentioned the phosphoinositol pathway.
Yeah.
And I'll be honest, I had to rewind that a couple times.
It's a mouthful, isn't it?
It is.
But you can think about it this way, right? This pathway, the phosphoinositol pathway, it's like
Right.
this really complex communication network in the brain.
Right.
And lithium seems to step in and kind of modulate or change the signals that are being sent.
Wow.
And what's really interesting is that, this pathway might also be involved in other mental health conditions. So understanding how lithium interacts with it could have like broader implications for treatment down the line.
Wow. So it's not even just about managing, like you said, those immediate symptoms of
Yeah.
mania. It's potentially like opening these doors to a deeper understanding of how the brain works.
Exactly. Yeah. And, while lithium can be incredibly effective,
Right.
it's not without its potential side effects, right? So some are pretty common, but then you have some more unusual ones like nephrogenic diabetes insipidus. And it's where it's important for you as someone learning about this to really understand the impact.
Yeah, I'll admit that one sounded pretty intimidating.
Yeah.
What does that
Well,
actually mean for someone taking lithium?
yeah, so essentially, nephrogenic diabetes insipidus, what it does is it affects the kidney's ability to concentrate urine.
Okay.
So what that leads to is excessive thirst and frequent urination,
Oh, wow.
which can be really disruptive to daily life and might require like adjustments to the medication or
Right.
lifestyle changes.
Gotcha.
This is why open communication with your doctor is so important.
So it's a side effect you definitely wouldn't want to ignore.
Absolutely not. And then there's another one that's rare but serious. It's called Ebstein's anomaly, which is a heart defect that can actually occur in babies who are exposed to lithium during pregnancy. Wow.
So that's why it's really crucial for women of childbearing age to have, very thorough discussions with their doctors about the risks and benefits of taking lithium.
Okay, so we have lithium targeting the manic pole, and then the video shifts gears to lamotrigine,
Right.
which seems to be more effective for the depressive side of bipolar disorder.
Yeah.
What makes that one stand out?
Yeah. So while lithium primarily targets mania, lamotrigine kind of works in a different way, and it can be really helpful for those experiencing those layers of bipolar depression. But it's important to note that lamotrigine carries a risk of a severe skin reaction
Right.
called Stevens-Johnson syndrome.
Yeah, the video really drove home how serious that is.
And for good reason, it's a life-threatening condition
Wow.
characterized by these really painful blisters that can cover large areas of the body and can even affect internal organs.
Oh my gosh.
So, being aware of this risk is critical for both patients and healthcare providers. Yeah, so if lithium is primarily for mania and lamotrigine is often used for the depressive episodes, what happens when someone experiences both
Right.
mania and depression in rapid succession?
Right.
That sounds incredibly challenging to manage.
It can be. Yeah, and that's where valproic acid comes into play.
Okay.
That's often the preferred choice for what's called mixed or rapid cycling bipolar disorder,
Mm,
where people experience very frequent shifts between those two poles.
yeah. Yeah.
But, like any powerful medication, it also comes with its unique set of potential side effects.
Yeah, the video listed some pretty serious ones for valproic acid, things like thrombocytopenia, which means low platelet count,
Right.
which can lead to bleeding problems, along with potential liver damage and even pancreatitis,
Yeah.
which is inflammation of the pancreas.
Right.
That's a lot to consider.
It is, and it highlights why choosing the right mood stabilizer is not a simple process, right?
Right.
It requires really careful consideration of that person's specific symptoms, their medical history, their potential risks. Right.
It really is a balancing act.
So we've got these kind of three major players, each with their own strengths and potential drawbacks.
Right.
The video also briefly mentioned carbamazepine and oxcarbazepine.
Yeah.
How do those fit into the picture?
Yeah. Think of those as options when the first-line treatments, like lithium, lamotrigine, or valproic acid, haven't been effective, or the side effects are just too difficult to manage.
Okay.
They work in similar ways,
Yeah.
but just like the others, they also come with their own set of potential complications.
Yeah. Carbamazepine, for example, can cause a drop in white blood cells, which is called a granulocytosis.
Right.
Now, I know that that makes someone more susceptible to infections, but could you explain why that happens?
Sure. So white blood cells are essentially the body's main defense against infections, right?
Right.
Carbamazepine, in some cases, can interfere with the production or function of those cells,
Okay.
leaving the body more vulnerable to infections that it would normally fight off with ease. So it's not just a minor side effect. It could have some pretty big consequences.
Right.
And then there's that term P450 inducer, which the video mentioned in relation to carbamazepine.
Yeah.
I remember learning about that in school, but I honestly needed a refresher.
Yeah, you're not alone. It's a bit of a technical term.
Sure.
But essentially, carbamazepine can speed up the breakdown of other medications in the liver.
Okay.
Think of it like this. You have a factory, that's your liver, and it processes these medications. And then carbamazepine comes in and makes all the workers go into overdrive.
Okay, so the medications get processed faster.
Right.
Why is that a problem?
Well, it means that those other medications might not stay in the body long enough to actually be effective.
Oh.
Or in some cases, the rapid breakdown could lead to like a buildup of byproducts that could cause like unexpected side effects.
So if someone's taking carbamazepine, it's not as simple as just adding another medication to the mix.
Right.
It could create this domino effect.
Exactly. It's this very complex interplay, which is why, monitoring medications and communicating with your doctor is so important.
Right.
Now, what I thought was so interesting is how the video didn't stop at just listing the medications and side effects.
Yeah.
It actually took us through these like real world scenarios to demonstrate how doctors use lab results and patient presentations to figure out if a medication is actually causing a problem.
That's where that medical detective work really comes in.
Exactly.
Yeah.
So, for example, if a patient on carbamazepine comes in with signs of an infection, and their blood work shows a low white blood cell count, that's like a huge red flag.
Yeah.
Or imagine a patient on lithium with elevated creatinine levels.
Okay.
That could indicate that the kidneys aren't functioning the way they should.
Right.
And then, of course, there's the classic presentation of Stevens-Johnson syndrome with those painful, widespread blisters. That's a strong indicator of a potential reaction to lamotrigine.
It's fascinating how those seemingly unrelated pieces of information, a rash here or some blood work there, can all point to a specific medication.
Yeah.
It's like solving a puzzle.
Yeah, it is.
So how does a doctor, armed with all this knowledge, actually approach treatment?
Well, the first step is always a comprehensive assessment, right?
Yeah.
So that means gathering detailed information about the patient's symptoms, their medical history, their lifestyle, any other medications they're taking.
Okay, so it's not just about looking at what mood stabilizer they're on. It's about getting that full picture,
The full picture.
of their overall health.
Exactly.
Okay.
And then based on all of that information, the doctor can start to narrow down the potential causes of those symptoms, right?
Yeah.
Lab tests, like the ones we just talked about, can play a crucial role in confirming or ruling out certain diagnoses.
So it's this combination of detective work, clinical knowledge, and a good dose of communication. And that brings us back to the importance of that open dialogue between the patient and their doctor.
Absolutely. This is a partnership.
Right.
Both parties need to be actively involved in making those decisions about treatment.
Well, I don't know about you, but I'm already feeling like I've learned a ton
Me too.
just from this first part of our deep dive.
Yeah, and we've only just scratched the surface.
Yeah.
Yeah, there's so much more to explore. And you know what I thought was really fascinating is how the video didn't just focus on like the clinical aspects.
Right.
It really touched on something that often gets overlooked, which is the individual's experience.
Right.
These medications, as we've been discussing, can have profound effects on someone's life.
That's a really good point. It's easy to get caught up in like the science of it all.
Right.
But ultimately, it's about how these medications impact a person's day-to-day life, their relationships, their sense of self even.
Exactly. Like imagine someone who's struggled with these debilitating manic episodes.
Right.
Lithium could be totally life-changing for them, allowing them to hold down a job,
Right.
maintain relationships, engage with the world in a way they couldn't before.
Yeah, it's almost like these medications can give someone back a part of themselves that they thought was lost.
It really can be incredibly empowering,
Yeah.
but it's also important to acknowledge that even with the right medication, managing bipolar disorder is an ongoing process, right? It requires like a multifaceted approach
Yes.
that includes therapy, lifestyle changes, a strong support system.
So it's not just about finding the right pill.
Right.
It's about creating a more holistic approach to well-being.
Exactly.
And that kind of makes me think about the video's emphasis on the practice questions section.
Right.
It really highlighted how doctors use clinical reasoning
Yeah.
to figure out what's going on with the patient.
Yeah, those practice scenarios were like these mini mysteries, right?
Right.
They take us beyond the textbook knowledge and really show us how the pieces fit together in real life.
Yeah. I was struck by that example of a patient with low platelets. I remember thinking, okay, low platelets, that's bad.
Right.
But how does that connect back to a mood stabilizer?
It's a great example of how a seemingly isolated lab result
Right.
can actually be like a crucial clue.
Right.
So in that scenario, the doctor would immediately think of valproic acid
Okay.
because one of its known side effects is thrombocytopenia,
Oh.
which, as we talked about before, means a low platelet count.
Right. And that can be serious.
Yeah.
Right.
Yeah.
Because platelets are what help our blood to clot.
Exactly. So a low platelet count means that the body's ability to stop bleeding is compromised,
Right.
which can lead to things like easy bruising,
Yeah.
prolonged bleeding from cuts,
Mm.
or even internal bleeding in severe cases.
Wow.
So if a patient on valproic acid presents with those types of symptoms,
Right.
it's a very clear sign that we need to investigate further.
So it's not just about memorizing the side effects.
Right.
It's about understanding the underlying mechanisms and how they can actually manifest in a patient.
Yeah, it's like connecting the dots to see the bigger picture.
Yeah, exactly.
And, it's this ability to connect the dots that really sets apart a good doctor from a great one.
Right.
It's really the art of medicine, blending that scientific knowledge with clinical experience and intuition.
And I imagine that's especially crucial in a field like psychiatry where there's no single test to diagnose bipolar disorder.
Absolutely. It's a diagnosis based on a constellation of symptoms,
Right.
the patient's history, and careful observation over time.
Yeah.
And choosing the right medication is equally nuanced.
Right.
It's not just about matching a drug to a diagnosis. It's about really taking into account that individuals' unique circumstances and their preferences as well.
So for our listener who's now absorbed all of this incredible information,
Right.
what are some key takeaways they can walk away with?
I think the most important takeaway is that mood stabilizers are powerful tools
Yeah.
that can significantly improve the lives of people with bipolar disorder. But, they're not magic bullets.
Right.
They really work best as part of a comprehensive treatment plan that
Mhm.
addresses the person's needs on multiple levels.
And that treatment plan should always be developed in collaboration with a qualified healthcare professional
Yes.
who can guide them through that process, right?
Absolutely. Open communication, trust, and shared decision-making are so crucial.
Yeah.
The patient should really feel empowered to ask questions, express any concerns, and be actively involved in their own care.
Now, the video we've been discussing focused primarily on the clinical side of things,
Right.
but as with any area of medicine, there are also broader societal and ethical considerations.
That's a really important point as we delve deeper into these complexities of mental health.
Yeah.
It's crucial that we consider the ethical implications of treatment.
For example, how do we ensure access to these life-changing medications
Right.
for everyone who needs them?
Access is a huge issue.
Yeah.
And it's intertwined with these broader societal challenges like healthcare disparities and economic inequality.
And what about the stigma surrounding mental illness?
Right.
Does the use of medication sometimes reinforce the idea that there's something fundamentally wrong with people who experience these conditions?
That's a complex question, and there are strong arguments on both sides.
Yeah.
Some people argue that medication can help to destigmatize mental illness by showing that it's a treatable medical condition like any other.
Right. It's not a personal failing.
Right.
It's a matter of brain chemistry.
Right.
But I could also see how the reliance on medication could lead to a sense of dependence
Yeah.
or reinforce the idea that these conditions can't be managed without external intervention.
It's a very delicate balance, and I think it really highlights the need for these ongoing conversations about mental health, both within the medical community and society as a whole.
It's about fostering understanding,
Yes.
empathy,
Yeah.
and creating a more inclusive and supportive environment for people living with bipolar disorder.
Exactly, and that brings us to another important point, which is the importance of ongoing research.
Right.
While we've come a long way in understanding and treating bipolar disorder,
Yeah.
there's still so much we don't know.
That's why initiatives like the Brain Initiative are so exciting.
Yeah.
They're really pushing the boundaries of neuroscience, giving us these new insights into how the brain works,
Right.
and hopefully paving the way for even more effective treatments in the future.
Absolutely. And it's not just about developing new medications. It's about exploring these innovative therapies, these personalized approaches to treatment
Yeah.
and, finding ways to support individuals throughout their journey with bipolar disorder.
It's about recognizing that mental health is a spectrum,
Yeah,
and there's no one-size-fits-all solution.
precisely. And that's what makes this feel so dynamic and constantly evolving.
Right.
There's always something new to learn,
Yeah.
new discoveries to be made, and new ways to improve people's lives.
So for our listener who's now armed with all this knowledge,
Right.
what's a thought-provoking question that they could explore further on their own?
What's fascinating to me is the history of these medications.
Yeah.
Take lithium, for example.
Okay.
It's been used to treat bipolar disorder for decades,
Mhm.
but its discovery was actually quite accidental.
Oh, yeah. I remember reading something about that. It was initially used for something completely different, wasn't it?
Yes, it was first used to treat gout.
Oh, wow.
And it wasn't until much later that its mood-stabilizing properties were even discovered.
Wow.
And even then, its early use was met with a lot of skepticism and controversy.
Yeah, it makes you wonder how many other potentially life-changing medications are out there just waiting to be discovered or repurposed.
Right. It's a reminder that scientific progress is often a winding road
Right.
with these unexpected twists and turns.
And that curiosity and a willingness to kind of challenge conventional thinking can lead to incredible breakthroughs.
Absolutely. And speaking of curiosity, I have another thought-provoking question for our listener.
Okay.
What are the ethical implications of using mood stabilizers in children and adolescents?
That's a huge one.
It's a really complex and often controversial topic.
Yeah.
On one hand, early intervention can be crucial
Right.
in managing those symptoms of bipolar disorder and preventing long-term consequences.
Right.
But on the other hand, there are concerns about the potential side effects of these medications on
Right.
developing brains.
Right. And the ethical considerations around consent and decision-making when it comes to treating minors.
Exactly. It's a topic that requires really careful consideration,
Yeah.
nuanced discussions, and a deep understanding of both the science and the ethical implications.
Well, this deep dive has certainly given me a lot to think about.
Me too.
It's amazing how much we can learn from just one YouTube video
I know.
when we really take the time to unpack it.
I completely agree. It's a reminder that knowledge is everywhere if we're just willing to seek it out and engage with it thoughtfully.
It's been quite a journey, exploring this world of mood stabilizers.
It really has.
We've gone from those like basic mechanisms to the real-life applications, even touched on those ethical considerations.
Right.
It's incredible how much one YouTube video can spark such a wide-ranging conversation.
I know. It's amazing. And it just goes to show that learning is like this continuous process,
Yeah.
We are always uncovering new layers of understanding, even with medications that have been around for decades.
And I think that's what makes this deep dive so valuable. It's not just about memorizing these facts. It's about developing a deeper appreciation for the complexities of mental health
Yeah.
and the efforts to improve treatment and support for people with bipolar disorder.
I couldn't have said it better myself. And it's inspiring to see how research and clinical practice are really pushing the boundaries,
Yeah.
leading to new discoveries, more personalized approaches to care.
So as we wrap up our exploration of mood stabilizers, is there anything else that stands out to you as particularly important for our listener to remember?
One thing that really struck me throughout our conversation is the individuality of each person's journey with bipolar disorder.
Right.
What works for one person might not work for another.
Right.
And finding the right treatment plan is often a process of trial and error,
Hmm.
guided by that open communication with their healthcare professional.
That's a really important point.
Yeah.
It's about finding what works best for you, not just following a cookie-cutter approach.
Exactly. And recognizing that managing bipolar disorder is an ongoing process.
Right.
It requires commitment, self-awareness, a strong support system.
It's about finding the right tools and strategies to navigate those ups and downs,
Yeah,
knowing that you are not alone in this journey.
absolutely. And, I think the video we discussed today is such a great example of how accessible information can be so empowering.
Yeah.
Even a single YouTube video, when explored thoughtfully, can spark curiosity, deepen understanding, lead to those more informed conversations with healthcare providers.
So for our listener who's been with us on this deep dive, what's a final thought-provoking question or idea that they could kind of take away
Mm.
to continue their exploration?
What's really fascinating to me is the emerging research on the gut-brain connection,
Oh, wow.
its potential implications for mental health.
Okay.
There's this growing evidence that the bacteria in our gut can actually influence brain function and mood.
Wow, that's incredible.
Yeah.
So what we eat and the health of our gut microbiome could play a role in managing conditions like bipolar disorder.
It's a really promising area of research, and while it's still early days,
Yeah.
it opens up this whole new avenue for understanding and potentially treating mental health conditions.
It's like another layer of complexity in this already intricate puzzle.
Exactly, and it highlights how interconnected our bodies and minds really are.
Well, I don't know about you, but I am definitely adding gut-brain connection to my list of things to research
Me
further.
too.
It's amazing how this deep dive has just opened up so many new avenues for exploration.
Oh, I know. It's really cool.
Well, on that note, we've reached the end of our deep dive into the world of mood stabilizers.
You're right.
We've covered a lot of ground today,
We have.
from the basic science to the human impact, and we've even touched on some of those broader ethical and societal considerations.
It's been a truly fascinating exploration, and I hope our listener has come away with a deeper understanding of these complex medications
Yeah.
and the people they can help.
And remember, if you're ever feeling lost or overwhelmed, there's always help available.
Right.
Don't hesitate to reach out to a mental health professional or a trusted friend or family member.
Well said. And as always, stay curious, keep learning,
Yes.
and never stop exploring the fascinating world around you.
Until next time, stay informed and keep those brainwaves buzzing.